Hi there, Doug Lindsay here with 10 slides in 10 minutes. Your financial questions answered in 10 minutes or less. Let's start talking about Medicare. So, you're approaching that magical age of 65. Maybe you've even already arrived. How does this work? It can be a little daunting, so in the next 10 minutes, we're going to explore the basics of Medicare. Before you turn 65, there are many choices. The main one we're all familiar with is employer group plans. This is the insurance you have through work. There are lots of other kinds. For example, retiree health insurance can start if you're under 65 and retired from your job. COBRA takes you between jobs. You can also buy an individual plan on the exchange under the Affordable Care Act. And there are lots of other ways too, VA benefits, Medicaid, and others. Part of what makes medical insurance so complicated is just this: lots of plans with different rules from the get-go. Once you've turned 65, Medicare is your primary payer. You will have to sign up for Medicare at 65 unless you work for a company with 20 or more employees or your spouse works there. We'll call this a large employer throughout this video. Your other insurance, maybe retiree insurance or a Medigap plan, pays second to Medicare. I'll repeat, once you turn 65, you must sign up for Medicare unless you are covered by an employer group plan that covers 20 or more employees. This coverage is based on your current employment or that of your spouse. For example, if you're retired and on your company's retiree plan, you still must sign up for Medicare at age 65. The safest path is that no matter what you're doing at 65, 3 months before that magical birthday, start calling and asking questions. What if I forget to sign up? If you miss the deadline, you can be charged late penalties for the rest of your life. For each year that you should have enrolled in Medicare and didn't, your premium will increase by 10%. 2 years late, 20%. In 2016, that would mean about a $25 penalty per month for life. Next, you may not have insurance. If you miss your enrollment period and have to wait a year for the next general enrollment, you will be without insurance for an entire year. Wrap yourself in a plastic bubble and hide in a closet. Finally, your private insurance options may be limited. For example, Medicare supplemental or gap policies have a 6-month open enrollment, and they have to take you during this window even if you have health problems. Afterwards, you may have to go through underwriting, and your gap policy may cost more, or you may find yourself uninsurable. What does original Medicare, that's parts A and B, cover? A is your hospital insurance, and B is for your doctor bills. More on that in a minute. These numbers are current as of 2016. If you're in the future, I predict it will cost more. The first 60 days of a hospital visit are covered after you pay a $1,288 deductible. Then you have coinsurance for each day after that. Skilled nursing, often needed for rehabilitation, is covered for 20 days. Coinsurance of $161 per day through day 100. After that, 100% paid by you. Any doctor visits or outpatient work is covered 80%. You pay the other 20%. And many preventative services are fully covered. These deductibles and copays are the reason you must get additional private insurance to go along with Medicare. Get a copy of the 160-page booklet, Medicare and You. I recommend downloading it to your Kindle or iPad, as wrestling with the weight of this large physical booklet may actually cause bodily harm. Medicare does not cover long-term care, nor does it cover dental, vision, or hearing. Do you think older folks sometimes need help with their teeth, eyes, or ears? Drugs aren't covered, nor are alternative treatments. This is where private insurance plays an important role. You can buy long-term care insurance or hybrid annuity products to cover the costs of nursing homes. You can buy an Advantage plan or Medigap supplemental policy to cover deductibles and copays. Some even provide dental, vision, and hearing. You can pay for Part D drug insurance to cover drug costs. And for alternative care, you'll likely just need to have good old-fashioned money. There are 5 parts to the Medicare system. Parts A and B are the original Medicare. A covers hospital visits and B is for doctors. Then Medicare added Part C, also known as Medicare Advantage plans. These are offered by private insurance companies and provide a one-stop shop for all your medical needs. Think HMO, usually with drug coverage included. Most importantly, they cover much of your copay and deductible costs. In Albuquerque, where I work, there are 5 different companies offering Advantage plans. Some of these plans have no additional premiums, but you still have to pay for Part B. And some of the fancier ones might cost you $100 a month or more. If all of your favorite doctors are in the network, this might be a good fit for you. Another way to cover those copays and deductibles is through supplemental insurance, aka Medigap. The coverage rules of these private insurance policies are governed by Medicare. The plans are lettered A through N, and costs vary from plan to plan and state to state. Finally, there's Part D to cover prescription drugs. In a nod to the red and green chili choice of New Mexico, notice the green box around Part C and the red boxes around the others. These are the 2 ways to get complete medical coverage at age 65. Either you go green and select an Advantage plan, or you go red and have Parts A, B, D drug, and a gap plan. Costs and coverage vary. How to pick between these 2 options is covered in a separate video. There are 2 ways to buy Medicare. On the left is Original Medicare. Here you have Part A for hospital coverage, which for people who have 10 or more years of work history is usually free. I remember that A is hospital because you ride in an A ambulance to get there. Since everybody wants their kid to be a doctor, Part B covers doctor visits. As of 2016, Part B costs $121.80 per month, more for high earners. Next, add a Part D drug plan for about $50 per month. Finally, pick a supplemental plan. These plans start with a letter from A through N, and since Plan F provides the most coverage, I call it the F for freaking awesome plan. It costs $150 to $200 per month. This is like ordering off a restaurant menu. Get a B and an A and a D and a gap, and you've got bad gap. I don't know what that is, but it's the best I could do with the letters provided. Now move over to the right side of this decision tree. This side describes choosing an Advantage plan or Part C. Part C combines all of the coverages of A, B, D, and gap into one plan. Note, some of these plans don't have drug coverage, so you have to add your own Part D. I call this the Club Med plan because Club Med starts with C, like Part C. It's an all-in-one buffet where all your medical care is provided by one company. Again, you still must pay for Part B. Some Part C plans are free, and some have additional monthly premiums. Let's talk about starting Medicare. Enrolling in Medicare is easy. They'll start taking the premium right out of your check. For most of you, in the 3-month period before your 65th birthday, you need to sign up for Medicare. Technically, there are 3 different enrollment periods. If you're not covered by an employer group plan with 20 or more employees, then you need to sign up during the initial enrollment period. That's the 3 months before your 65th birthday. This period actually lasts through your birth month and 3 months after 65, but there is no good reason to wait. Next, if you did keep working past 65 for one of these large employers, then when you retire, you have a special enrollment period. Call before you retire to enroll. It's that simple. Finally, if you miss both of these chances, you have a general enrollment period. Sign up is from January 1st to March 31st for coverage beginning July 1st. The main goal is to ensure continuity of coverage, so don't miss these important dates. If in doubt, call Social Security, your insurance company, your HR department, or my office to ask questions. Missed deadlines can mean higher costs, gaps in your medical coverage, or even denial of insurance. See the bottom of this screen for contact information. Here's a typical Medicare budget that we use with clients. The monthly cost of Part B is $121.80 in 2016. Medigap Plan F costs $200 a month. Add in a Part D drug plan for $40, and you've got $361.80 per month. Multiply that by 12 to get an annual cost of $4,341.60. Add in $800 for out-of-pocket drugs. Add another $800 for dental, vision, hearing aids, and alternative care. That gives you a per-person annual cost of almost $6,000. For a couple, double it to $12,000. This is not cheap. Likely your most expensive cost in retirement. We can help you plan for your medical costs. Please call the MGM office for assistance in starting Medicare. That's the end of this session of 10 slides in 10 minutes. Hope you enjoyed it. I'm your host, Doug Lindsay. If you need additional information, remember to go to our website, and please tune in to our next session. As always, contact us if you have questions.